I'm Kristin Dunkle, and I'm currently Chief Specialist Scientist for the What Works to Prevent Violence Against Women and Girls global program, which is headquartered at the South African Medical Research Council. I got into public health because I was interested in violence against women. I sort of landed in South Africa the first time in my mid-20s, and that sort of finished undergrad, not sure about grad school, trying to figure out what you're going to do with your life. And I ended up spending a year volunteering for a really great NGO called People Opposing Women Abuse, doing counseling and education services for them as a volunteer. And that was in the mid-90s, which was just when the HIV epidemic in South Africa was starting to hit, but also, just 2 years into the democratic transition, and it was a really just amazing and fruitful time to be there. Among the things they did was real advocacy work, and there was a point when they were talking about the statistics on intimate femicide, so basically women being killed by their intimate partners, and they were citing a piece of research that said, I think, 1 woman killed every 6 days, or I don't remember exactly what it said, but there was a statistic that became the real rallying cry for it, that when the program got fully underway and got to Parliament, somebody then started questioning, well, where does this number come from? And it turned out that the research supporting it was not super solid, and then the whole thing kind of fell apart. And that wasn't a failure of advocacy particularly, but it was for me a real example in the ways in which, if you want to speak truth to power, it's helpful to speak their language, and very often having really compelling numbers is really meaningful. It was a sort of object lesson in high quality research is good for advocacy. If you're going to advocate for uphill for an agenda that people object to, it's, one of the things that's really useful in that process is unassailable evidence. DFID really had a vision for kicking up the global evidence base on violence against women and girls, and in particularly we're interested in expanding knowledge about primary prevention, and put out a call for proposals with the idea that there would be a large consortium of projects headquartered in the Global South that would look at strategies for innovative but evidence-based prevention in lower and middle income countries. The secretariat for the program is headed up by Professor Rachel Jukes, who's obviously one of the luminaries in the What Works to Prevent Violence Against Women and Girls field. And we have been collaborating at this point for nearly 20 years, since 1999. And it's been amazing over the last 20 years, and particularly over the last 5 to 10 years, to watch how much the field has taken off in terms of, there were a bunch of early pioneers who were just trying to, document it as a public health issue, document health impact. A bunch of amazing women who did that work. But the fact that the field has progressed to a point where we can be not just having conversations about primary prevention, but developing and testing really effective intervention and having violence understood as the major public health issue that it is. So at the moment we have 15 different projects in 13 different countries. We've got 7 projects in Africa, 8 projects in Central and South Asia, all in DFID priority countries. So the program in Rwanda is called Indashikirwa, which is Kinyarwanda for Agents of Change. And the thing I like about that program is it's a multi-level program with a number of different components that address different places where risk is generated. So at the sort of individual and family and ground up level, there's a 5-month training program for couples, couples in the general population, that addresses a range of topics from women's economic empowerment to handling conflict, effective communication, violence prevention, sexuality, a range of topics. And then couples who complete that program have the option to go on into another 2-month training in community activism. As all of that has been transpiring, there's a whole other element of the program which is about the creation of an enabling environment, because asking individual people or even individual families to make change if the environment isn't conducive, or if there's not sort of broad-scale social change, we know that doesn't work very well. The enabling environment components included a range of elements, the biggest of which were trainings and support for opinion leaders. So political leaders, service providers, religious leaders on violence against women, and just understanding the basics and also thinking through how their roles could be helpful in supporting prevention efforts. There was also the creation of a women's safe space, which is a sort of drop-in center for women who are experiencing issues to get support and referrals, and they also run sort of community outreach and programming. They've added a whole element where women in the community with disabilities who may not be able to access services otherwise, they're doing sort of home-based outreach, and just a whole wide range of services coming from there. So it's about sort of sensitizing the political leaders and religious and service providers for the need for change, creating a sort of centralized place for resources, and having some support and facilitation so that that environment can meet the sort of ground-up activities and community education activities. And the evaluation is looking both at the impact on the individuals who sort of go through the couples and family training process, and then looking at broader diffusion of innovation and whether you can actually get community level change. Most of our projects are focused on prevention of intimate partner violence, and so in that case, the primary outcome in all cases is occurrence of intimate partner violence. At baseline, you establish people's sort of lifetime history of either victimization or perpetration, and then what's happened in the past year. And then pretty much across the board, the programs then take a baseline time point, a 1-year time point, and a 2-year time point, and sort of look at is violence continuing? Has it ceased? Are there any cases where there wasn't violence before and it started? But it's a pretty standard way of measuring it. We're using an adapted version of the WHO Violence Against Women instrument, and part of that is very specifically to be able to both compare across our projects, but also to be able to benchmark against the major international population-based studies in terms of, were we targeting high-risk populations? Were we not targeting high-risk populations? It's really helpful to have the coordinated measurement strategy. So in Rwanda, again, the primary outcome is physical and sexual partner violence, but we're also looking at a range of secondary outcomes, including economic abuse, emotional aggression, and looking at whether we can also have a beneficial impact on things like general health outcome, mental health outcomes. What's been really amazing to me is to the extent that we have global evidence, the patterns of risk factors are remarkably similar across contexts. The issues where, there are certain areas that are consistently areas of conflict that people don't get good skills to manage around male sexual entitlement, substance use, infidelity, not always on the part of men for all of those. Allocation of household resources, women who've experienced violence in childhood, men who've witnessed violence in childhood. The impact of experiencing or witnessing abuse in childhood, that's pretty universal, but how it manifests over the life course depends on where there are support and prevention services. The thing that I think is the most different, and there are a range of things, but the thing that tends to stand out for me is if you look at lifetime prevalence versus past year prevalence, just like some really simple comparison of data. Your lifetime prevalence for experience of something like intimate partner violence or sexual assault is not that very different in the US versus in other contexts. But particularly for intimate partner violence, there are a lot of settings where the figures for past year and the figures for lifetime are not that different, because people have a sort of ongoing and continuous exposure to violent situations. What you often see in the more developed countries is the lifetime figures are similar, but the past year figures are lower. And that says to me that in more resourced settings, either that have socioeconomic resources or that have social resources and social services, people who find themselves in bad situations are able to exit. And the same tends to apply if you look across socioeconomic categories in the US. I think the thing that I would most like to see for the field overall is a real understanding that it's very hard to, and We talk a lot about links between economic empowerment and prevention of violence, but it's very hard to do effective violence prevention if you don't have a sort of baseline level of livelihood stability. And so we have a number of programs like the Stepping Stones Creating Futures program in South Africa. Our program has an element. There's the Women for Women International program that we're evaluating in Afghanistan but operates in a bunch of places. To do basic livelihood strengthening so that people have a basic platform under them, I think is really essential for doing effective prevention work, and at the same time doing that work, and particularly with a focus on women's economic empowerment, without doing the gender transformative work, both for women to understand their own rights, but also for men to understand the benefits of women's economic empowerment and to get on board with it. You know, there's a lot of evidence in the field that can result in unanticipated consequences. So I think marrying those two things, or at least saying you can't do one without the other, I think very fundamentally trying to do violence prevention if you haven't done basic livelihood stability is really problematic. So, for example, in the Rwandan case, part of the objective was to be looking at a wide range of intervention strategies. While we're looking at across a range of strategies, all of the projects were chosen in part because they're well tailored already to the communities that they serve. Obviously, there are engaged and super committed partners inside Rwanda and a vast team of them, just amazing people. It can be very disheartening to work in a field where there's so much stress and trauma, but the resilience of people and the commitment of so many people, I don't know that it's surprising, but it's continually heartening. I think for me, the big thing has been getting to meet so many really committed, smart, passionate people doing the frontline work in so many different settings.